Next thing that's important for you to do is to get the medication that you're going to give the patient, and you want to spike the bag. So we're going to go ahead and spike the bag. Okay, you're going to move the machine within the lockbox, and you're going to hang your pain medication. Once you hang your pain medication, the next most important thing to do is to ensure that the tubing is not kinked, and there are a set of hinges under the machine and a hook on the cassette. What you want to do is unlock the cassette. This locks the cassette in place, and you are going to, in those hinges, put the cassette. Once you press, you're going to close the lock. Once you close the lock, the second most important thing to do is to actually lock anyone from playing with that cassette. Once you do that, you're going to press the power button. Okay? When you press the power button, you're going to follow the orders given to you and the process that needs to be done. In this case, I have a scenario, battery is low, I'm going to acknowledge it, we're going to ignore. I'm going to say I'm going to start a new patient. So what do I need to know? For this scenario, the IV-PCA mode that I need to use is palliative care. So if I'm going to do palliative care, I'm going to go and look for the therapy that I'm going to be given. Okay, it's not on this one, so what I'm going to do is going to choose IV-PCA, which is the second most common treatment that we give. So we're going to select IV-PCA, and then is it an opioid naive patient, an opioid standard patient, or an opioid tolerant patient? And that's where it's important to know the substance abuse history of your patient, or how much they were medicating themselves before they came to the hospital, especially for patients with chronic pain. So we are going to select someone that's opioid standard, someone that has a condition where they've taken opioids and now they're getting surgery, let's say, and they need a PCA. So you're going to select opioid standard and click select. What are we going to give them? An opioid standard person, most of the times, there's two drugs that we give a lot for opioid standard for pain management at the Mount Sinai Health System. It is hydromorphone or morphine. So we're going to select morphine, and the concentration needs to match the concentration in your bag. So the concentration of this morphine is 1 milligram per ml. We're going to select that. The next thing it's going to tell you is to put the code. So as I said earlier, and when you come to nursing education, your code in nursing education is 007. So once you click 007, it's going to ask you if the settings are correct. Is the therapy IV-PCA? Yes. Is it opioid standard? Yes. Is the drug morphine? Yes. And what's the concentration of the drug? 1 milligram over 1 ml. I'm going to select yes because that is the correct dosage. Because it's opioid standard, a lot of the settings are automatic, so you do not have to play with any of the settings of the machine. It's going to ask you to review the settings of the pump. When you click review, the PCA dose, every time they press the button, they're going to get 1.4 milligrams in this case. If your order is different, you're going to select that, and then you're able to change the standard dosage. In this case, we are not going to save it because it is the correct order. It's 1.4 milligrams every time you press it. They could only get one dose every 8 minutes. In 1 hour, the max dose of morphine that the patient will get is 11.2 milligrams, and the reservoir is right now at 100% or 100 mLs because we have not primed the bag. Once we do this, we accept all the values, we accept everything, and you'll see that there is a check mark that comes up. Once you get the 4 check marks, you're going to hit next. Once you press next, you are going to prime your tubing. The way the priming works in the CAD PCA pumps is that it does an automatic priming. So I'm going to click yes, I want to prime the tubing, and what we're going to be looking for is, is it, okay, prime, okay. Patients. Okay, it gives you a warning to disconnect the tubing from the patient. Remember, that tubing has around 4 mLs of air, so if you connect the tubing to the patient before you prime it, you're gonna give all that air to the patient, and we don't wanna do that. So we're gonna click prime. The machine will automatically prime, and the most important goal is that when it primes, it's around 4 mLs, if I'm not mistaken. Let me just make sure. And what we're looking for is for a couple of drops of the medication to come out from the tubing. It's around 4 mLs, so around the 4 mL mark, we should be paying attention to the actual tubing to make sure that the air is, and here we go, hold on 1 second, that there's a couple of drops. Once there is like 1 or 2 drops, you are going to stop priming. Okay? Now you connect this to the patient. Therefore, there's no air in the line. It's gonna ask you if you want to continue priming. If you say no, the next thing it's gonna tell you is to start the pump. Ensure that you are connected to the Y line, the closest line to the patient, and you connect this to the patient. When you start the pump, it's going to tell you, you know it's correct because most likely it will ask you to press the button or there will be a green light. So that's how you set up a pump. So when you press a dose and a dose is given, it says PCA dose started, and now you have another 8 minutes before another dose can be given to the patient. Okay? So thank you very much for your time, and we'll see you in nursing education, where you'll get to play with the machines and get more comfortable with them. Welcome to Mount Sinai.